All right, so thank you all for joining us for our second session of Finance and Health. I'm Tarnika Manning, the Administrative Director for the Office of Equity and Minority Health here at the Lurie Cancer Center. And today we have Erin Bear, who will be sharing with us dealing with cancer while working. So there's definitely a number of challenges that come with trying to balance work and life um, general, but adding cancer is definitely another obstacle to get over. So if you have any questions, feel free to put them in the chat box. And with that, I'm going to hand it over to Erin.
Thank you so much. I'm Erin Bear. I am a staff attorney at Triage Cancer, and I'm delighted to spend the late afternoon, evening with you. I wanted to share a little bit first. It sounds like everybody's familiar with Triage Cancer, but just in case, I'm going to tell you a little bit about us. So we're a national nonprofit organization, and we provide free education on the legal and practical issues that impact or might impact individuals diagnosed with cancer and their caregivers. And as we were just discussing, we have a lot of resources available on our website, lots of different formats. So today we're going to be focusing on employment law, but please know that there are lots of resources on other areas of law as well. On our website, you can also register for various educational events. I'll tell you about a few of them towards the end of our time together. And then since we know people learn in different ways, we try to have resources available in different formats. So we might have quick guides, but we also have short videos. We even have a podcast. So as we go through, you'll probably see that there are links during the presentation. I'll do my best to let you know as we go through where you can find the corresponding resources on our website. So financial toxicity is something that we talk a lot about. In 2013, researchers out of Duke coined the term financial toxicity, and it's become a bit of a buzz term over the last several years. In their research, Duke looked at the out-of-pocket expenses and the effect that it had on individuals diagnosed with cancer. And the effect, it was kind of similar to the impact it had on somebody's, as the physical toxicity of a cancer treatment can have, it has a long-term impact on someone's quality of life as well. So we don't just look at the dollars and cents of it. They looked at how the financial impact can affect quality of life over, a great period of time. So financial toxicity is a relatively new term, but it's certainly not a new problem. Unfortunately, there's no easy solution to financial toxicity. And one of the reasons why is because there are a lot of different contributors, and each one has to be separately addressed. So we think the primary culprit is having adequate health insurance. So please know for more on that, we have great resources on our website, how to pick it, how to understand it, how to use it, because I don't know about you, but I find health insurance to be just like a big labyrinth to try to get through. And so we try to make it as easy as possible. But today, we're going to focus on potential employment changes that can also impact someone's financial health. And so having a good understanding of the law is our best protection. Before we jump into the substantive stuff, I'd like to kind of introduce you to Olivia. She can kind of give us, set the stage for what an individual might be going through and the things today that might be helpful for her. So Olivia was diagnosed with cancer of tonsils and larynx. Olivia decided to work through treatment, and she's a cashier at a supermarket. She hasn't told anybody about her medical condition. She took 2 weeks vacation for her time off and her surgery. She is now in her 3rd week of chemo and is having trouble with fatigue and is limited in the amount of time that she can stand at one time. She also has to constantly be drinking water because the effect of the treatment dries her mouth. So because of the large amount of water she needs to consume, she has to use the restroom pretty frequently. However, the supermarket does not allow folks to have beverages at their workstation at the checkout stand, and they only allow for breaks every 4 hours. And Olivia doesn't know what to do. Well, by the end of this program today, hopefully we will be able to give Olivia some options. And just so you know, Olivia is actually a real life person who worked at Albertsons and a subsequent lawsuit when they didn't give her the reasonable accommodations that she was entitled to. So without further ado, when we're talking about employment rights, there's actually a lot of different places that we can go for information about them. So there are laws that we call fair employment laws, and they protect people against discrimination in the workplace based on their medical condition. It also gives them access to reasonable accommodations, which we'll talk about more in a few minutes. Now, there are laws like the Americans with Disabilities Act that exist on the federal level, but there are also laws that exist on the state level too, that are also leave laws that allow you to take time off work and also provide some job protection and health insurance protection. So again, they can exist at the federal, state level. Sometimes they're even available at the county or city level. And then sometimes we forget that we work under an employment contract. And so when we're under an employment contract, maybe we get access to a different benefit, but we're waiving access to another benefit in exchange. So the example I give often is teachers, folks in teachers unions typically don't pay into Social Security because they have their own retirement system. So from their employment contract, because of there's some nuances there, they can't obtain Social Security disability benefits. All this just to say that depending on your job, depending if you're in a union or what your employment contract is, can also impact your rights. Before we get into the legal protections available, it's also important to remember that the law provides the bare minimum of what employers need to provide. And thankfully, there are employers who want to provide more than that and provide something that's much better than the bare minimum under the law. So I'm always advising folks to check with their employer's policies as well. And if you're wondering where to find them, they're typically in an employee manual or kind of a policies and procedures document. And if you don't have something like this, you can ask your human resources representative. And if you don't have a human resources representative, whoever handles your benefits would be a good person to ask about these policies. And these policies can include all sorts of different benefits like health, dental, vision, disability insurance, sometimes life insurance. So anything about PTO, vacation, whether you can donate hours to colleagues would all be information that you would find out. And it's important to know because a lot of times this is where you could find information about asking for medical leave or asking for a reasonable accommodation. So we're going to jump into the specifics, starting with the Americans with Disabilities Act. And it is a federal law that prohibits discrimination against folks with disabilities. And it does it in several contexts, including the workplace. So you might be familiar with the ADA. A lot of people I talk to are familiar with some of the access requirements of public buildings, like how there need to be accessible parking spots or accessible bathrooms or ramps into buildings. But there's an entire section of the ADA, Title I, that's entirely focused on employment, and it's enforced by the EEOC. Now, unfortunately, not everyone is going to be protected under the ADA. There are a few hurdles that someone has to clear. So first of all, an employee has to work for a private employer with 15 or more employees or work for a state or local government. If you're a federal employee, you still have protections. It's just going to likely be under the Rehabilitation Act of 1973. But for all intents and purposes, it's very similar to the ADA in its employment protections. In addition to working for the right-sized employer, you also have to be what's called a qualifying individual. So that just means that you're qualified for your job and you can perform the key responsibilities, even if that's with a reasonable accommodation. And again, we'll come back to reasonable accommodations in a minute. The last hurdle that you have to clear is that you have to meet the ADA's definition of what a disability is. Now, I want to point out that almost every single law we talk about today is going to have a different definition of disability. So we're going to need to pay attention to that because it might be a different analysis depending on what law we're talking about. Under the Americans with Disabilities Act, a disability is defined as a physical or mental impairment that substantially limits life activity, a major life activity. So we break that down, and it's first, you must have a physical or mental impairment. It has to limit a major life activity, and it has to be substantial. So it can't just be minor, it can't just be occasional. What is a major life activity? Pretty much it's anything that the average person in the general population can perform without difficulty. Typically, that's breathing, sleeping, walking, but also concentrating, and even just the operation of major bodily functions can all be considered major life activities. And I like to point out that when we're talking about cancer, oftentimes it's not the cancer diagnosis that itself creates the disability. Rather, it's the side effects from treatment that someone's experiencing, like nausea or chemo brain or lymphedema or fatigue, and that those are limiting major life activities. It could also mean that like one of those side effects is substantially limiting, or it could be that several side effects all roll in together are, altogether creating a combination of factors that would create a disability. So I want to point out that when we're looking under the Americans with Disabilities Act, it's a case-by-case basis. And we're going to look to see if their individual situation would qualify them under the ADA. So once you've shown that you're qualified, or that you have qualified or you're eligible under the ADA, you're typically going to fall into one of four groups that can use the ADA's protections. So first, you yourself have the physical or mental impairment that substantially limits a major life activity. The second is maybe that you have a history of an impairment. Maybe you're a 5-year survivor. Everything's fine, but maybe your employer is treating you differently because of your previous diagnosis. The third way isn't even really about you at all. It's just how you're perceived by your employer. So for example, if you lost hair following chemo, but you're otherwise ready to work, but your employer makes assumptions based on, based on your appearance, well, that person is protected as well. Finally, the fourth way to be protected is based on an association with somebody with a disability. And so this is where protection for caregivers often comes in under the Americans with Disabilities Act. I like to point out that the ADA applies to all phases of employment, not just being an employee, but if you're applying for a job, you have ADA protections. So before you even get the job, you have protections under the ADA. So that begs the question of what the ADA can do for us. In all these circumstances, for all four groups that I just referred to, it protects against discrimination in the workplace. In addition, if you are in groups 1 or 2, if you currently have a disability under the ADA or have a history of a disability, you also might be entitled to reasonable accommodation. So now we're going to dive into what those are. So the legal definition of a reasonable accommodation is any change in the work environment or in the way things are customarily done that enables an individual with a disability to enjoy equal employment opportunities. Now, that's not really clear. So I think the best way to talk about reasonable accommodations is to use examples. But keep in mind that on a practical level, reasonable accommodations can be pretty much anything. So breaking it down into different categories, 3 categories, the first is about physical workspace. This could include moving offices or having special equipment or a more accessible parking spot or office near the restroom. The second is a change in schedule. So it might be about adjusting your hours to take additional breaks. It could be about extending leave or changing schedule. And then there's the last bucket, which is pretty much everything else. So maybe that's about technology, maybe it's about a policy. Let's think back to our friend Olivia from the beginning of our presentation, our case example. It could be a reasonable accommodation to allow water at her station, or to take additional breaks. Or maybe it's about shifting responsibilities. So let's say you're a school teacher, not only asked to teach, but also to do recess duty. And you're feeling fatigued, and so you ask for a reasonable accommodation so that somebody else can maybe handle that recess duty, another employee can, so that you can rest during that time. It can also be about changing jobs entirely. Now, this only works if there is a vacant position. It's not to say that employers are required to provide a new job opportunity for somebody. But if there is a vacant position and the employee is eligible for it, it could be that reasonable accommodation could be about shifting to a new job. So when we talk about reasonable accommodations, there are some practical pieces. So sometimes we hear from patients that, my employer's been wonderful, they've been really helpful and so supportive. I just don't want to ask them for one more thing. But the reality is employers are required to provide eligible employees with reasonable accommodations, unless they can show that it's either an undue hardship or a direct threat. And both of those are very high bars for employers to meet. So this is required for them. Now, I also want to clarify about what's going to be considered a reasonable accommodation. And that's going to be very specific based on your job and your employer. And what a reasonable accommodation is for one person might not be reasonable for another. For example, a bus driver probably isn't going to be able to telecommute their route. So it has to make sense based on your job responsibilities. One of the great things about reasonable accommodations is that they're pretty flexible. And so you can get more than one to deal with everything that you're coping with. And you don't have to just find one that will help with everything. You're, entitled to whatever is going to help you with your situation. And those needs can change over time. So what someone needs right after a surgery could be very different once they start chemo or radiation. And so your accommodation at work can be adjusted to meet your changing needs. Now, as we saw earlier, and just to remind you, individuals who are caregivers, unfortunately, though they're protected against discrimination under the Americans with Disabilities Act, they are not legally entitled to reasonable accommodations. But I put this in the it can't hurt to ask category. And even if you are a caregiver and aren't necessarily entitled to reasonable accommodations under the ADA, to still ask, because employers want to keep valued employees. So there's no harm in asking. And there's really good reasons for employers to provide these reasonable accommodations. A lot of people don't know this, but the cost of accommodations is typically really low, and half of them pretty much cost nothing. And then in exchange for that cost, there are a lot of benefits that the employer gets as well. So it typically will increase employee performance. It also increases the time that they might stay with the organization. And it's important to know that people who call the Job Accommodation Network for help, a lot of them were doing so because they wanted to promote or retain an employee. They had their best interests in mind. Which makes me think I should probably tell you a little bit about the Job Accommodation Network, or JAN, and it is a very valuable resource. It's funded by the US Department of Labor, and their mission is to help employers and employees navigate reasonable accommodations. So they have an excellent blog, and they also have a searchable online database where you can put in your job and your side effects, and it will suggest different accommodations that might be helpful for you. So it's a really valuable resource. Now, asking for accommodations brings up a number of practical questions. One, employees should ask for an accommodation as soon as they realize that they need one. Because if you don't ask for one and whatever you're coping with starts to affect your performance, then your boss or your employer might end up making decisions like demotions based on your job performance because you're not protected because you didn't tell them about your need for reasonable accommodation under the ADA. So how do you ask? You don't have to specifically say the ADA or invoke the specific language of reasonable accommodations. But, and this happened earlier today, talking with someone, we often see employees in the position of having to educate their employer about reasonable accommodations. And remember that Jan, the Job Accommodation Network, can help with that too. So who do you ask? You can go pretty much to the person that you feel most comfortable talking to. However, you probably do, like I said in the beginning, want to check your employee manual to see if there's a specific process that your employer prefers that you use. But I would also suggest someone take into account their workplace and their workplace culture. So if their supervisor, their direct supervisor, is their biggest advocate, then maybe that makes sense that that's the first person you're going to go to. But then if I'm concerned about maybe what my supervisor might think or how they might respond, then maybe it's better for me to go to HR. Speaking of which, when an employee asks for an accommodation, the employee's medical condition is supposed to be kept confidential by the employer. So it shouldn't be like announced at the next staff meeting. But you should know that while the underlying diagnosis or need for reasonable accommodation is confidential and shouldn't be disclosed, your supervisor or other colleagues might need to be made aware of the accommodation, like you're not going to be working on Fridays. So when asking for a reasonable accommodation, employers and employees have to engage in what's called the interactive process. And that's just really the official title for negotiating and communicating and the ongoing monitoring that's involved with reasonable accommodations. It also means that if I, as an employee, say to my employer, I need reasonable accommodations to telecommute, my employer just can't say no, that's it, end of story. They are expected under the ADA to maybe say, I can't perhaps do that for you because of the nature of your job, but I can give you the afternoon shift or the morning shift because you feel better during those times. It has to be this ongoing dialogue between the employer and employee to find something that works for both. And it can go back and forth. It can go back and forth until an accommodation is agreed upon. And then again, there's going to be an ongoing assessment of how it's working for both parties, if it's still effective, if it needs to be changed. Most states have a state law that is very similar to the ADA, but it's important to note that some states are more protective. For instance, some state laws cover employers with less than 15 employees. But then in addition to the Americans with Disabilities Act, we're going to take a look at fair employment laws as well. So there are also, so I think every state except Alabama and Arkansas has a state fair employment law that tracks with the ADA. And in some cases, again, that they're more protective than the ADA. And also some of them have maybe a broader definition of what is considered a disability, or might even list cancer as a disability that qualifies. This chart shows the number of employees each state requires an employer to be covered by the state fair employment law. So for example, in Illinois, your employer only needs to have you, one employee, to be covered by the state law. And if you're curious about a state that isn't listed here, it means it's consistent with the Americans with Disabilities Act, and it covers employers with 15 or more employees. And I like to bring this up because it just shows how important it is to know about your state law in addition to federal law, because it can make an incredible difference. I did want to mention, even though we're talking about employment, that we also have similar protections in the education arena. These are protections against discrimination at school and also provide reasonable accommodations at school. And these are going to fall under the Idea and Rehabilitation Act of 1973. I just want to let you know that we have resources about it at cancerfinances.org, where we have an entire module where we walk through these benefits in detail. Similarly, we have an entire module on housing rights as well, because there are additional protections here as well. And again, you can find that under Cancer Finances module on housing. Next up, for employees who need to take time off work, either due to their own medical condition or caregiving responsibilities, that's when the Family and Medical Leave Act, or commonly referred to as FMLA, comes in. So it is a federal law, like the ADA, and it's enforced by the U.S. Department of Labor's Wage and Hour Division. It allows eligible employees to take time off for either their own serious medical condition or to take care of a child, parent, or spouse with a serious medical condition. And that's a really narrow definition of what family qualifies, like who you can take time off, protected time off with for different types of family. It's just spouse, parent, and child. So unfortunately, if you wanted to take time off for a sibling or a grandparent, that is currently not protected under the FMLA. There have been some efforts to expand access, but unfortunately so far, none have been successful to date. There are requirements that must be met to be eligible to use FMLA benefits. So under the FMLA, an employee has to either work for a private employer with 50 or more employees or a public employer. And how do we count those 50 employees? Well, do they work within a 75-mile radius of one another? Now, this is important if you say, oh, well, my office, we only have 36 people, but in the next county over, we have another 20. You can actually count those offices together as long as they're within that 75-mile radius, if you need to hit that 50 employee mark to be protected under the FMLA. In addition, in order to have coverage under the FMLA, you have to work for your employer for a long enough time. So it requires that you be with your employer for at least 12 months and work at least 1,250 hours during the last 12 months they worked for the employer. This is a bit confusing, but note that the 12 months actually doesn't have to be consecutive. It can be cumulative. So let's say you worked for an employer for 5 months. 3 years later, you're back. Well, after 7 months, you would be eligible for FMLA because you get to count both of those periods of time for the same, working for the same employer together. The bottom line is that as long as the employer has worked for a minimum of 12 months in the last 7 years, and the employee has worked at least 1,250 hours, then the employee is eligible to take leave. So what does it actually do for you? Some people are surprised, understandingly, and disappointed that it does not provide paid leave. It entitles all eligible employees to take a total of 12 weeks of unpaid leave per year to manage their own serious health condition or to act as a caregiver. So the downside is that a lot of people really can't afford to take unpaid leave. And that's where disability insurance can come in really handy, which we're going to talk about in a little bit. But the major benefit of FMLA is what we call the FMLA bubble. And in that bubble, you're protected from losing your job. So you can't be let go for taking leave. The employer cannot hold taking leave against you. And generally speaking, when they return from leave, the employee has to be reinstated to the same or an equivalent position as they had when they took the time off. It might not be the exact position, but it has to at least be the equivalent. And job protection under the FMLA is really important because a lot of us don't think about it. A lot of us think, oh, well, I'll just take sick time or I'll take vacation time. But that isn't protected time. FMLA, they can't hold against you, whereas there's not similar protections if you're just taking regular PTO. Another huge benefit of FMLA is that it protects your health insurance if you get your health insurance through your employer. So if your employer pays all or part of your premium for your health insurance, they have to continue to do so while you are on leave. They don't have to keep up their other types of benefits, like they could put on hold disability, life, dental, other employee-sponsored benefits, but they cannot drop your health insurance coverage or stop paying for it. And even if someone does temporarily lose some employer-sponsored benefits while they're out, typically once someone returns to work, those benefits are reinstated. So there is some nuance to actually taking FMLA. And the first, thankfully, is that it's pretty flexible. So you can use it all at once, or you can use it in smaller segments rather than taking the whole 12-week block of time. So perhaps you want to use a couple weeks for your recovery, for your surgery and your recovery from surgery. And then maybe in the weeks after that, when you start your chemo appointments, you take 1 day off a week. Or maybe, for your radiation treatments, you're taking 4 hours off in the morning. So you can take it in segments. You can also take it intermittently, meaning that you don't need to know necessarily ahead of time of when you're going to need that FMLA leave. You can call in sick on a day you're not feeling well and use FMLA time so you get, again, that access to job protection and health insurance protection. Now, the employer has to provide this every year, and it can be a little tricky as to when that year begins. There are different ways an employer can count a year as to when that FMLA benefit renews itself. So you'll want to check with your employer. There's also a notice requirement if you want to use the FMLA. So typically, we need to provide notice for leave that's foreseeable. And if we have a need that is foreseeable, we're supposed to provide the employer with 30 days notice. So if I know I'm going to have a surgery in January, I'm supposed to give my employer 30 days notice of that surgery. But I do want to point out, most of the time when we're talking about cancer care, sometimes the need for leave is unforeseeable. And so you just let your employer know as soon as practicable. So that might just be 1 to 2 business days as soon as you become aware. Sometimes someone will come to me and say, I have sick time, I have vacation time, I've got my FMLA time, I've even got disability insurance. I want to string them all out to be off work for as long as possible. I'll ask, can I do that? And the answer is, it depends. Because an employer is allowed to require you to substitute the unpaid leave under the FMLA with any paid leave that you have accrued. And remember, you're only protected, your job is only protected, and your insurance is only protected during the time that you're taking the actual FMLA leave. But there's a caveat there. Keep in mind that if you need to extend your leave past 12 weeks, and you want to keep protections for that extension of time, you can actually use the Americans with Disabilities Act there too. You can request a reasonable accommodation to extend your leave by a particular period of time. It's also really helpful because with the FMLA, like we discussed, employers have to have 50 or more employees. So maybe you work for someone with just 20 employees, so you're not protected under the FMLA, but you are protected under the ADA. And so asking for that reasonable accommodation might provide you with some protections for taking leave in that instance as well. Now, How much time is reasonable is not clear. There have been conflicting cases across the country. The Supreme Court might be taking that up at some point to provide some guidelines. But in most states, courts have ruled that employers may be required to provide additional time off as a reasonable accommodation. So remember that there are state laws that can be more protective than federal laws. These are just a few examples. So they may drop the threshold of how many employees are covered. Some include more family members that are covered under the FMLA. I want to mention that disclosure and privacy is a topic that we often hear about and want to discuss with folks. A lot of people think that they have to disclose their underlying cancer diagnosis in order to take advantage of the ADA or the FMLA. And that I want people to know that that does not necessarily mean that they have to disclose their cancer diagnosis. There is an expectation that you provide some documentation from your doctor to support the reasonable accommodation or to support the leave. But because the accommodation is based on side effects, which are medical conditions on their own, you can talk with your doctor about ways to phrase the request or the supporting documentation and have it limited to the side effects if you're concerned about disclosing a cancer diagnosis at work. And we have several resources you can see on the slide that speak specifically to disclosure. I also want to acknowledge that there might be a situation that goes past all of the things that we've talked about today, and you need additional help, and you want to point someone towards some additional resources. Again, I'm going to point you towards our website for more information on employment and disability insurance. And speaking of which, disability insurance is the next topic that we're going to talk about. So when someone is diagnosed with cancer, there's at least some time that they will likely have to stop working. And if that time is extensive, most people are going to have to find a way to bring something to replace that paycheck. And so that's where disability insurance comes in. It's wage replacement. It replaces your income that you lose because you're not working due to that medical condition. And they typically only cover a portion of what you get paid. So I've seen policies range from 45% to 90% of monthly income. Disability insurance is one of those things that most people don't proactively go out and purchase, which is a shame, because if you're a 20-year-old, you have a 1 in 4 chance of dealing with a disability. And, you know, that's before you are even able to get an individual disability insurance policy. So it's all the more important to know at any age how to get disability insurance. And there are several places where you can get them. So the first is a private policy, and these can be purchased directly from an insurance company, or you can have access to a policy through your employer. Now, I speak to folks all the time who are like, I don't have that benefit. And then I say, maybe go back and check your employee handbook. And sure enough, they do have that benefit. They do have access to disability insurance. So always go and check. Unfortunately, unlike health insurance, where they can't discriminate against you for having a pre-existing condition, if you're buying a private disability insurance policy, they can deny you based on a pre-existing condition, and they can charge you higher premiums. So after a serious medical condition or diagnosis, it can be difficult to access that type of coverage. And the details of these private policies are really going to differ from like employer to employer, plan to plan, and state to state. Another thing to keep in mind is that there are short-term and long-term policies. The short-term policies generally last between 6 and 12 months, and long-term policies are typically 12 months or more. So a lot of times I find it difficult to answer questions people ask me because the answers are so specific to their insurance policy. But there are some general things I suggest that folks ask or find out about with their coverage. So how does the policy define disability? Is it a really high standard, or is it an easier standard to meet? What percentage is it going to pay out? It's going to pay out 50%, it's going to pay out 80%. I would also want to know how long those payments are going to continue. Are they indefinite, or are they only last for a certain period of time? And if you're not sure, if you don't have the policy, you can get this information from either your insurance company or your employer. In addition to private policies, there are a handful of states that have state disability insurance. If you live in California, New York, New Jersey, Rhode Island, Hawaii, or Puerto Rico, then you actually pay into that system through your state payroll taxes. And you can double check for that by actually looking at your pay stub. These typically are short term and last for up to a year, but they can be a really fantastic option for someone in one of these states, because they need that wage replacement, but also the standard of disability, like the definitions of disability that can vary so much, like we were talking about. The standard of disability for these programs is typically lower than what we would find for the two long-term disability plans under the federal government, which we're going to be talking about next. Those are federal disability plans that are run by the Social Security Administration. But if you want to check out more about your state's benefits, or even to find contact information about your state programs, you can visit triagecancer.org/state resources. So there are two federal disability insurance programs that are both administered by the Social Security Administration, and can get confusing, and people often confuse them, understandably. The first is Social Security Disability Insurance, or SSDI, and the other is Supplemental Security Income, or SSI. And like I said, both of them have very high standards of what is considered a disability. They define the disability as a medical condition that's going to last 1 year or longer, that keeps you from working, and not just working from your current job, but pretty much any job you've had in the last 15 years. So it's a very high standard of disability. It's, of all of the laws that we've been talking about, it has the highest standard. I also want to mention that, though it is a federal program, it's run through state disability determination services agencies. So it could mean that one person in one state is told something a little bit differently than someone in another state, even though they're both federal programs. I point this out because I don't want folks relying on maybe what their brother in a different state said that they went through, because each state is going to have a slightly different process. Some of the key differences between SSI and SSDI is with SSI, you have to meet low income and asset requirements. You have to make under a certain amount and have under a certain amount of resources available to you. Thankfully, that doesn't include like your house or your first car, but any other resources might preclude your eligibility if they're over $2,000 or $3,000. The maximum benefit that you can get is set for everybody, and that's $943. And typically folks will qualify right away. And the health insurance that accompanies SSI is Medicaid. For SSDI, eligibility is all about whether or not you've worked and put enough into the system. And unlike SSI, there is a 5-month waiting period for you to get SSDI. And unfortunately, that is the case for any disability that you're seeking SSDI for across the board, even if it falls under a compassionate allowances list, which will kind of move the process forward. Maybe if you have like a diagnosis that they automatically will expedite the process, there's still that 5-month waiting period. And then health insurance wise, after 2 years of being on SSDI, you get Medicare. So here's how we can know if we're eligible for SSDI. So I used to get paper statements that would tell me how many credits that I had to qualify, but now we have to go to the website to find out. And so one thing it'll tell us if we've had enough work credits to receive benefits. And then another really helpful thing is it'll tell me based on my specific work history what my benefits would be if I were to become unable to work due to a medical condition. So you can know that before time, before even applying for it, what that's going to look like. Now, we have a lot of resources related to disability insurance, including quick guides that I've mentioned, and entire modules on disability insurance. We also have another webinar on our website that has content that is similar to today's. This is being recorded, so hopefully you'd be able to pass it on if you know somebody who would benefit from it, or if you want to refresh it yourself. I want to spend a moment talking a bit about income for caregivers. Most of us can't go without working for an extended period of time without some sort of income. And that goes for caregivers too. And there are limited options for caregivers who need to take time off and who need to have some sort of income or wage replacement. So the states are some place to go and check for that. Most of the states have a broader definition of family than under federal law, and they also can include some job protection for people who take leave for being a caregiver. But even if you aren't in one of those states, or even if you are and you just don't qualify for paid leave, there is also a Medicaid program to check out. It's an optional benefit. It's not available in every state. But if someone qualifies for Medicaid, they might qualify for in-home support services. In-home support services. And that's where a family member could actually get paid to provide in-home support services. I will say that it's different in every state, and it's often the subject of budget cuts. So things change over time, but it's definitely worth looking into. And we have information on those types of programs on our website as well. And even though it's different in every state, it's all going to be run through the Medicaid program of every state, which is also confusing because sometimes each state has their own name for Medicaid. It makes it even a little bit more confusing. We're about out of time. I want to make sure that there's some time for questions, but I also want to let you know about some other resources. So coming up in just a couple of weeks, we have our free conference, and it's 2 days. It's online, and we provide a lot of additional information that we touched upon today and a lot more. We also have our monthly webinar series where we do a deeper dive into different legal topics. Today, we did a deep dive on estate planning. And if you aren't able to attend live, don't worry, we put it up on our website so you can watch the recordings later. Our quick guides and checklists are basically fact sheets that provide an introduction to different topics. They can help guide you through appeals or accessing insurance or crowdfunding. And these materials can be downloaded from our website, but I also want you to know that you can you can go on the website and order printed materials in bulk, and we will send them to you for free. We also have our award-winning practical guides to cancer rights, and this is going to cover the 3 main areas of law that affect someone with a cancer diagnosis: employment, like we talked about today, insurance, and finances. And if you go through our website and you have questions about your individual situation and you need additional help, or maybe in the next 8 minutes I don't get to your question, or you have additional ones, please, please, please feel free to reach out to our legal and financial navigation program. Anybody can contact us. We're happy to provide one-on-one guidance around what your options are, what your rights are, help folks feel more empowered in the situation that they're experiencing. So you, can go on triagecancer.org/get-help, fill out a short intake, and we'll set up a 30-minute call. Actually, typically 30 minutes. It can be longer than that too. So anyway, I would love to, at this point, go into questions that y'all might have. Thanks so much. No.
Thanks, Erin. Any questions? Erin, I think she knocked herself out the conference. She got so
I
excited.
think, I think Kelly Mitchell had his hand up.
Oh, yeah, I did. I was like, wait a minute, Erin
Yeah,
knocked herself out. Hold
yeah.
on.
Oh my goodness.
Uh, Hey, how you doing today?
Good, good, good. Thanks for joining us today, Kelly. So
Thanks for
Erin's
having
back
me.
on. I think she's gonna be ready to answer your question.
Oh, how embarrassing. Just
Okay.
as
No,
we
I
were
was like, you got
being
so excited, you
recorded.
knocked yourself out. Like,
Hey everybody, how you doing? Thank you, Aaron, and thank you, Tarnika, for facilitating the group. I'm newly diagnosed, I guess you could say. It's been since January when it all came down. And so with that said, needless to say, everything has just been about face in my life. And I'm learning as I go with this. And one of the things that's kind of at the forefront right now is my doctor recommending that I look into disability, and I did. And then what I did is I got an approval. Well, basically I got an approval for early retirement because of my age, and so then from there they told me from that my disability would be pending on that. Then I checked later, found out the disability compensation is the same as my early retirement compensation. He said that essentially means same thing as my disability, which is significantly lower. And my doctor told me my diagnosis should expedite the disability process, but it seems to be going the other way. And then also I went to see a lawyer today, in fact, and the lawyer looked at it and she pulled up my page on the Social Security platform, and it said that disability is pending, and there was like a time bar that showed the extent of the progress that is being made with the disability processing. So she said, based on that, she can't do anything because I haven't been approved, yay or nay. But yet I was told verbally I didn't get it, but then the computer screen said something different. That reminded me what you said, Ms. Bear, about the variation from the states, even though it's federal. But in this case, it's all still under the same, uh, I guess you could say, platform, and which is here in Illinois. But that's kind of what's going on right now. And I was just wondering, have any information or experience with that situation?
This is exactly the type of situation I would really highly encourage you to go and fill out the intake form for our legal and financial navigation program, because you're touching on a lot of different issues. And basically for every question you have, I'd have like 10 or 15 to ask you before I would even feel comfortable telling you about your options. But yes, somebody could talk with you, it might be me, about that waiting process, how long it takes.
All right.
Yes. Sorry.
Oh, no, go ahead.
Oh, yeah, there is a difference between what your benefits would be if you apply for SSDI versus early retirement. So I'm glad that that was at least at some point pointed out to you. A lot of people don't know that, and so they'll think, oh, I'll just retire early. But really, if they had gone through disability instead, that they would have a higher benefit. So all this to say, I think there's a lot that we can help you navigate through in terms of your options, not just at the federal level, but like you said, at the state level as well. Or we can look to see if there's options under the state as well. So this would be like your current situation would be like an ideal topic for conversation through our LFN. And then we'd also follow up with you with specific resources. And then you're not limited to like one call with us. You can schedule as many as you like, as long as you have questions.
Okay. I'm glad to hear your encouraging reply. Uh, so just again, it's a lot of information coming at me at one time. How would I begin to get this process with all these questions that need to be asked on my part with who the person might be? Where do I start? What's the phone number? Or
Yeah,
I don't want to use all this time because I know it's only 8 minutes. I'm sorry, everybody.
no. You would go to triagecancer.org/get help. That's all you do. Yeah.
Yeah.
And fill out the intake, and then you'll get an email to schedule a call when it works for you. And typically
Okay.
you can schedule a call within a week, sometimes two.
Okay. Thank you.
My pleasure. Any questions? I mean, it's such a good example, Kelly. I mean, there are so many laws at play in any specific person's situation, and it's hard to know. We think of it like a big puzzle. And so you have all of these puzzle pieces, like here's my work puzzle piece, and here's my government benefit puzzle piece, and my different types of government benefits, and trying to figure out how those work together. And I think that, that's where we excel in helping folks navigate this.
I'm sorry, I could have said a whole bunch of other stuff that goes along with the issue I just mentioned, but I didn't want to take up everybody's time. But there's a lot more questions I need, so I'll follow up.
Sure. I mean, just, we can't provide like legal assistance, but we are happy to tell you about the different laws and how they might be affecting you. And you can at least trust that when you call us, you're getting correct information, because sometimes there's a lot of well-meaning people, super well-meaning, but they're passing on information that is not accurate, or never was, or might not be anymore.
Okay, thank you.
Any last comments or questions for Erin while we have her for one more minute?
That's excellent presentation.
Wow.
Lots of information.
Thank you, Deborah.
Love it. Thank you. Thank you so much.
It is my pleasure. I love this work.
And thank you, Erin, for sharing all that great information. Again, I think my first interaction with triage was through the Working Through Cancer series that you all did. I think that was, again, a long time ago, but it's always good to hear it again, because things always change. And again, like we said last week, it's always something new when you're talking about this this topic here at hand. So, and thank you all for sharing some time with us and joining us this afternoon. We have our final session for the Finance and Health session, May 14th at 5 p.m., where we'll be talking about getting organized while with your diagnosis of cancer. So getting all those medical records, those finance records, the insurance stuff, all that stuff organized. So we look forward to seeing you all again on May 14th at 5 p.m. and have a great afternoon and evening.
Thank you.
Thank you.
Bye-bye.